Coming through.
All right, Educate US listeners, you may remember Mariekarl is the president and CEO of the Partnership for Maternal and Childhood Health of Northern New Jersey, where she is working to change the paradigm in maternal health. In her role, Mariekarl advocates for systemic changes to the healthcare system and oversees programs that empower communities and help families thrive. Mariekarl is a nurse who has worked on the front lines in hospital settings for most of her career. She understands the challenge of delivering quality care. Prior to joining the partnership, she served as the Senior Director of Nursing and Patient Experience at Jersey City Medical Center. Mariekarl oversaw a team of 700 employees and focused on patient safety and improving care. Wow. Speaking of improving care, as I was speaking to you right before the show, I am currently recovering from the norovirus. Dun,
Oh
dun,
my goodness.
dun.
Like, "Oh," it's like one of those horror movies you see, like
Yeah,
terrifying.
right? It comes in and sweeps out a whole family.
Yes, it will take out, 6'5", 250-pound man like a baby, right? It's quite devastating. It's more than wash your hands because you're still washing your hands, but it's every surface that
Mm.
someone may have touched, breathed on, and you think that you're being diligent, but it finds a way to get you and just decimate you for at least a good 4 or 5 days, right?
Mm. Wow. Yeah. So here I am recovering, and it's actually only day 3. So now when you just said 4 or 5 days, what can I expect on that day 4 and 5?
Well, it's good that, you're day 3. My family had it for, I would say, 7 days. My son was the
Mm,
worst. He was a good 5 days. He was out, vomiting, diarrhea,
mm.
fever. My daughter was at least four days, and my husband was a good 5 days.
Oh,
So they were out for the entire week, and I felt like I was, looking through the keyhole, being like, "Are you okay?" And leaving soup outside, and no one wanted to eat. And it is, yeah. And first you're like, "Is it the flu? Is it COVID? What is it?" You do all the tests, and you're like, "Oh, okay, it's norovirus. Everybody's got it. Everybody's got it."
oh,
And
that's
even if
good.
you're washing your hands at home, you go out to eat and, you're out at sporting events and you're holding doorknobs, you forget. And then you touch your face, you touch your eyes, you touch your mouth. You just have to be diligent everywhere you go.
Oh man, yeah, totally. And even when you're diligent, I'm assuming there's still a way for it to get you.
It is because people think diligent means using hand sanitizer, but it
Mm,
means washing your hands with soap and water.
yeah.
Washing your hands with soap and water. It's very important.
Yes, I did read that. I think it was back in the fall. There was an article in the Times and it was mentioning that. And the article was also exploring the fact that, we don't have a vaccine for the norovirus.
And I have to say, not to be political, how many people nowadays would take the vaccine? We have so much information
Mm,
about vaccines and their efficacy. It does work, but now we have so much disinformation and
mm,
misinformation that the average person is so afraid of taking something that will assist them in living a healthy life.
mm, mm.
It is very stressful for people in my line of work and your line of work of education, just saying, no, this is real science, this is education, this is, effective. It will help
Yeah,
you. Yeah,
yeah. Well, I have
crazy.
to say, if they had that vaccine, I would take it.
I too. I'm like, line me up. It's like, okay, I'm 57. What do I need to take that now? I'm like, oh, this just line me up. Pneumonia. What else do I need to take? Shingles, just give it all to me. Yeah.
Yeah. Yeah. Like you said, the science of it, it protects you and it protects others, right? Not
Yes.
just you, but other people that you interact with,
Hmm.
elderly people in your life that you engage with, right? We all know
Yeah.
how dangerous it can be.
Mhm.
for the very young in our life and the elderly
And
to get them.
yeah, it's really about being selfless. Look at
Hmm.
the measles outbreak. Measles. I mean, come on. Really,
Hmm.
we're talking about measles now? Yeah, it's
Mm.
distressing. So now we're going back here at the partnership where um having little videos that are 10 to 15 minutes long going back because so many people haven't seen measles. What does it look like?
Mhm.
You know, what is measles all about? People are like, oh, can I still get measles or do I need to get vaccinated? We're going back with small informational quick videos. This is measles. This is what it looks like. This is why you should get vaccinated. And just those small informational sessions that do not talk down to people. It's not, partisan. It is, here's the information. This is why you should get vaccinated. It's not just the vaccine, but it is the action of getting vaccinated that really saves lives. So very important about getting the immunization, especially with our new Health and Human Services leader.
Yes. It's interesting because I know there have been some backlashes about vaccines, and so great that your organization is putting out those small information videos. But I read an article recently said that, but most Americans actually do want vaccines. So some of what our new uh, what is his exact title again? I'm sorry, human
Health
and
and
health,
Human Services, yeah,
health and human services uh,
director.
leader, director. Yeah, I'm sorry, I'm almost opposed to learning the title.
Exactly. It's like, who is it? We don't want to talk about him. Don't even say his name. It's like Voldemort. He should
Yeah,
not be named. There's so many of them now that
yeah,
I don't
right.
even know who, just them, them,
Exactly. I'm not
them
sure.
there. Yeah.
So I thought that was interesting that even, yes, there's pushback and there is fear and there is misinformation for sure being spread. But I did think it was interesting that it's like, well, actually, though, most Americans want to get
Mhm.
vaccinated.
Mhm.
What do you find when you're, speaking with different people throughout that you all touch through your
Yeah.
organization?
Stacey, you're absolutely right. There has always been that segment of the population that are like, no, I'm not doing it because it is an affront to my civil liberties and I should be able to make up my mind. That has always been there, which we understand. The misinformation and disinformation has always been there. I believe the issue now is the amount of subtle disinformation that appears to be scientifically rooted that is so insidious. That is the problem. That has I don't want to say normal right side people that would be vaccinated start thinking, oh, well, I heard this from a reputable source. And then when you dig down deeper, it's like, oh, that's not a reputable source. That takes people that would be vaccinated and are on the right track and listening to their physicians, um, kind of now we're going left of center and bringing them back now is even taking longer. And now not mandating the schedule and having it be kind of permissible. Oh, if the physician wants to talk about it, as opposed to this is mandated, that's a different story. So now it's no longer mandated to um, have to, be required to go to school if they go down that route. And your doctor says, you know, they can have it now, they can have it later. Really, it's not a big deal. Of course, you're going to listen to your physician. So if you're not educated prior to, and you don't understand the efficacy and how important it is, not only to you, but society and public health, then you're going to be like, oh, it's not going to make that much of a difference. And it's not going to be that you're opposed to it or you're an anti-vaxxer. It's just going to be, it's not going to matter. My kids are fine. It's not a big deal. So I'm just going to stay out of it because the list of risks are so terrifying to me that it's not worth it. So the informed decision process is somehow hampered by the insidiousness of the disinformation that's out there.
Mm. That is, I mean, hearing you lay it out like that is scary, actually, to think about, right? Because part of what really makes these vaccines work is that there is a large population of people that get them, right? And that's really important as
But
we saw, honestly, right? With COVID. I mean, we saw
Mhm.
that.
Yeah, what's working, this is terrible, but what's working well and the best advertisement is the news saying, look what's happening in Texas. One day it's three people, now it's doubled, now it's three. And this explosion, and now people are like, oh, wait, is this real? And you're like, oh, yes, here's the real information. Look at this short video, and then you can make up your mind. So the infection itself and the proliferation of the disease is kind of like the best advertisement that we can get.
Yeah,
Yeah.
yeah. Wow. And are there a group of doctors anywhere that are sort of taking some kind of oath, like, oh no, we're gonna stand up
Oh, yeah.
and make sure? Yeah, how does that work or come
You still
about?
have the American Academy of Pediatrics that are like, oh, no, no, this is the schedule. Immunization works. You do have ACOG, which is for the Obstetrical College of OBGYN. You have A1, who are the nurses for OBGYN. You have the neonatal nurses. So you do have all of the medical societies that are like, no, we do believe in vaccines and we believe that this is the schedule and this is for public health. You have the Public Health Association that stand behind the immunization and they know that it works and this is the science and this is for the greater good. So you do have people that are speaking up and speaking out. So even though the news would make it seem as though, half of the world country has gone, more than half has gone crazy and they're all picketing. We do have people that are, I don't want to say coming to their senses, but acknowledging that vaccines and vaccinations are the way to go.
Well, that's good. If they're sticking to that. I do want to switch gears just a little bit to celebrate. Since we've last had you on the show, right? You have been named to the list of 100 most powerful women in New Jersey. Tell us about that.
First of all, I have to get my kids and my family to know. I'm like, hey, I'm on this list. You have to listen to me. They're like, yeah, not here, lady. It's like, yeah, okay. That was really a great honor. It was Assemblyman Shvaner Sumter who inherited the list from Senator, oh my goodness, now it has Weinberg. Um, yeah, she inherited the list from Senator Weinberg, and I spoke to her maybe 2 days ago, and I said, "Oh my God, this is such an honor." And I have been in this space of maternal health for 37 years, but only elevated to be recognized since I've gotten at the partnership because I have so much of a higher profile than being in the hospital, just working on a daily basis with the same things we've been working in the hospital, equity, making sure that we're speaking up for maternal health and diversity and making sure that people are just not surviving but thriving throughout this, perinatal health portion of their lives. It's been a great honor, to be on the list. And then subsequently, I received the Martin Luther King Jr. Service Award, specifically the Legacy Award from St. Joe's Hospital. And I'm driving on Route 80, and I have no sense of direction. And I see the billboard and I'm like, oh my God, I'm there. So I stop traffic, pull over, put on my hazards to take a picture of being on the billboard. So it has been such an honor to be recognized for the work that you're passionate about and really being able to change the paradigm and make sure that people are not only doing good work within the organization, but we're really impacting the lives of people in Northern New Jersey. So it's a great honor. So thank you for talking about that.
Yeah, well, I mean, I think it's amazing and well deserved for all of your work that you've done and continue to do. And actually, you brought up the paradigm, and you brought up, two words that we are just hearing in the media always right now, right? The diversity and equity. And so, as we were preparing for this episode, I was curious as to how some of the current policies are impacting your organization.
You know, it saddens me that DEI has become such a dirty word. And it seems like not it seems, in many instances, it appears to be synonymous with only African Americans or synonymous with just something that is untoward, which is untrue, right? So when we're talking about DEI, we're talking about equity. And whether it's DEIB or DEIA or DEI, whatever moniker you put to it, it is really just equity. So even if we scrub it and just call it equity, we're talking about who is at the table and who's most importantly not at the table. That's what we're looking at. And in our work, it hasn't changed anything at all. So we can change the syntax in our mission statement, but our work remains the same. That we are committed to helping and ensuring that the community strives, not only survives, because that is really important, that they thrive, and making sure that we look at everything that we do through an equity lens. Who is not at the table, who does not have a voice, and who is being overlooked. Because sometimes you think oh, this is what this community needs, but you haven't asked them. How do you know if you don't engage? And how can I purport to come into a community and assist them in thriving when I haven't lived their life, when I don't know what they need? We will come in and suppose that a specific community is not coming to their appointments because they don't care, or they're too busy, or they have a certain comorbidity. And really, if you ask the community, they don't have transportation. So I believe it's really important to have a diverse workforce. So that is equity. So you have more voices at the table, so you can have different viewpoints, and you can have a robust discussion. So what they're attempting to do and trickle down to the nation has not affected us in terms of changing our trajectory to becoming an anti-racist organization and making sure that we have full equity in our language, in all of our policies, in the people that we treat, in how we look at the grants that we take. So hasn't veered any way at all.
Well, that's fantastic to hear. Speaking of grants, have any of the federal cuts at all impacted your funding?
It's been a roller coaster. And one of the things that I have attempted to do and to steady the ship for the organization is not to react to the barrage of news feeds on a daily basis. Some of the information has been distressing as they've removed funding from the PRAMS data. That is the information that we get from the CDC that aggregates the data by race and ethnicity. So you can really drill down to see what's happening in different communities. But one day they say they are taking all federal funding from Medicaid, and then we're like, oh my goodness, what programs is that going to affect? Because that we have a Title V, we have a McBee grant that is mothers, infants, and children, and home visiting. So we have a very large home visiting program because we cover 50% of the state. So if they were to take the federal funding away from that, that would impact, babies and pregnant women and families that have very complex needs in the society. So it would be challenging to navigate those complex healthcare environments, and it would really lead to an increase of maternal morbidity and mortality. And of course, if that would happen overall, and then that would start to devastate the communities that would be most impacted. So we would see a devastation in the Black community, in the Asian community, in the Native American and Indigenous community. So that would just trickle down, and those effects would get more and more dire. Yeah. So it's unfortunate that we would have a government that would think to removing aid to those that are definitely the most vulnerable, is something that would be first on their agenda to do.
Oh, I agree. Sometimes I wonder, though, if they're so, in my opinion, sometimes I wonder if they even think about the impact at all and just start.
They understand. They don't understand what's happening. They don't understand. Obviously, they don't know the difference between Medicaid and Medicare. Because when you ask people, do you think people in Medicaid should work? And they're like, yes. It's like, and they should do their fair share. I'm like, well, do you know who gets Medicaid? Children, pregnant women, and old people. So where do you think? So it's about, again, the education. A lot of the society listen to sound bites, and they listen to TikTok and the disinformation. And unfortunately, it's really insidious, those very subtle, news bites and things that are happening. And it's really because society itself, they're scared, and it's a zero-sum game. People think that you give this to this portion of the society, you're taking something away from me. And we haven't seen the middle ground as to how we're all losing because we don't understand what's at stake. It can be very distressing, but we continue to do a lot of good work.
Yeah, it is really distressing when you think about it. And I would like to believe if our lawmakers and government really understood the impact, they would be making different choices. That might be a hopeful view. However, it is very harming what is occurring. And I do hope we see some shifts and we see some different stances coming out. I mean, similar to your organization saying, we're not changing the way we're operating, who we're focusing on, how we're supporting our mission. You are seeing more and more organizations and leaders coming out and saying the same thing. And in one way, I truly believe that is a revolt against what is coming out from our government. And I think it's really powerful.
Yeah. And that is the good thing. We are being very innovative, and we're really now coming together to think outside the box, to see this is the common enemy. It's like, okay, you voted for whomever, you were incorrect. People make mistakes, but now you see what the problem is and you have gotten back to your senses. So now let's get down to really the cause of getting together and moving forward as a people. So that is really, really important. Yeah.
Yes, moving forward as a people. I love that. With the humanity, right, at the forefront and at the center, which is just so important for us all to remember as we're moving through our days and the next years and such. I wanted to ask you a question. You spoke about, some of the education you're providing, right, around vaccines. I also wanted to know, what are the kinds of services and education that you are providing for reproductive rights and family planning?
I was thinking about this because we went to, myself and some staff members went to a reproductive rights forum in Atlanta a few months ago, and I was so shocked I went to a session, and they were specifically talking about states where reproductive rights were restricted, and states like ourselves in New Jersey where they are not. And the increase, I believe they said 1 out of 5. There had been an increase specifically in abortions. 1 out of 5 abortions in the first half of 2023 were from out of state, as opposed to in 2020, it was 1 out of 10. So there had been an increase of people coming to New Jersey. And because we are a bipartisan organization and we have quite a few Catholic hospitals on our board, it's not something that we talk about. But we do talk about reproductive health in terms of education and family planning, because family planning is very important within the diaspora and the sphere of women's health, right? If you have a comorbidity, especially if you look at the African American group, first, if you go back, if you look at the group of maternal health specifically, and you see that white women, their morbidity was 16.9 out of 1,000 births, and Black women went up to 49.5 out of 1,000 100,000 births, not 1,000, 100,000 births. That is alarming. And then when you look at the cause of death for Black women is cardiomyopathy and cardiovascular issues, family planning is very important. So you have to be able to make those choices. And that doesn't mean abortion. It could mean, just family spacing and spacing out of your pregnancy. So you have to have the correct information, whatever that may be for you. So we do provide education, and we do provide referrals to physicians and to different hospitals, so people can make an educated decision of what they want to do with their families. But going back to the webinar, the session that I attended, I was completely shocked to understand what was going on in some of these other places like Texas and Arkansas and Tennessee, where their laws were so restrictive. And if you were to travel outside of those states and come to New Jersey, and you were to have a procedure completed, and you were to get a prescription and go back to your home state, and you were to get a different prescription filled, and even by law, that is HIPAA protected information, so that is not to be shared. And I know in 2024, the Biden administration did update and strengthen that HIPAA protection, but in those states, it is illegal. So if you were to get misoprostol, and I could be looking at your chart and I could be like, oh, well, I'm going to call the police because it seems like Stacey went to New Jersey and now she's back in Tennessee, and it looks like she got misoprostol. I wonder what that's about. It's mind-boggling. It's mind-boggling to me that our reproductive rights, whether to have children, when to have children, how many children you can have, are being so diminished. And what they were speaking about was how you really have to have ethical note-taking as a physician, as a therapist, to protect your clients. So naming a specific procedure in your sessions makes those notes admissible, and it makes it a legal matter, as opposed to talking about your client's emotions and the situations that they're going through. So even now you have to really be very intentional about how you're documenting. And when you're documenting, if you're speaking to someone who English is not their first language, and you're using a translator, you have to be very careful as to what you're saying and what the translator is saying. Because if you are in one of those states, then the translator may call and say, I was just in a session, and the physician is now counseling this person to go out of state to have a termination. So we are so very lucky that we are in one of these, states where we do have reproductive rights, where we as a maternal health organization can provide information, and we can stop doing business with like crisis pregnancy centers, because we found that we were getting referrals and we were asked to work with pregnancy crisis centers. But what they did was they would call and say, oh, we have, we are an organization that provides maternal support, and we'd like to offer cribs and car seats and emotional support and counseling and this and that. And we had to dig in deep to find out what was happening. Is they were very predatory. They would go into Black and Brown communities and sometimes lower income communities, and sometimes very affluent communities, but they would set up and say, free pregnancy tests, free ultrasounds. And then that's when the misinformation and disinformation would start. And it would just be a very predatory downslope. So we made sure that people were aware of their practices and who they were, and that we were not doing business with them. And we had to name them. And of course, you get spoofing and so on and so forth. But, we are dedicated, and it is our mission to ensure that we are providing information, not disinformation. We are providing information so people can make the right decision for them. We can't allow predatory practices to prevail. It's not right.
Yeah.
So.
Wow. That's a lot to take in, right? I mean, this whole conversation, a lot of things to take in. I mean, the day-to-day support of maternal and child health, right, should not be so, it almost feels dangerous, right? It should be just something that is freely welcomed and encouraged and engaged with.
Joyful.
Yeah.
It should be. It should be. It should be. We, women, maternal health, we need a lot of support. There's the emotional load, there's the invisible load. There is, you have the PMADs, the perinatal mood and anxiety disorders that happen. You have women that are afraid to be like, I'm tired. I just want to break from these children, without people being like, oh my God, you're a bad mother. No, you're a human being, and even you're tired. And we have support groups every day that meet, because we know that it really does take a village. And I believe because of COVID, we have gone away from that, and people are now so siloed, and we're slowly getting back to that. So even if you can't meet in person, there are virtual villages that you can have, because it is challenging at best, but we do have ways around that.
Yeah, that's really awesome. So I want to just circle back before we start to wrap up here. You have talked a lot about misinformation and disinformation. So where can people go to find trusted information?
I would definitely say it is challenging, but we are definitely the source of truth. If you go to pmch.org, we have a resource page that will assist in pointing you to all the information that you need. We are also on our site. If you don't live in North Jersey, we are affiliated with the other consortium from Central and South Jersey. We also have information for our other community groups, and we also have national information there. So we do have a lot of sources of truth and resources on our pages there.
Okay, that's awesome to know. And in general, if people are asking, where do I get health information, period, where would you say this is where you should go?
Depending on where you live, I would always start with the Department of Health, especially Department of Health of New Jersey. Definitely nothing.gov right now. But your specific Department of Health, if you live in New Jersey, that will always be the source of truth. I think to start there, because anything else, and if you start with your what do you call that, professional organizations like American Academy of Pediatrics, if you're looking for what to do with your child and what is the schedule for your immunizations, that is a great place to start. If you have questions about maternal health, you can go to ACOG, acog.org, or AWHONN, WHONN.org. Those are maternal health organizations that will be able to give you specific science-based information and lead you to other additional resources.
Awesome. Thank you so much for that. And as we always like to say, is there a way people can follow or connect with you, Mariekarl?
Absolutely. pmch.org. That would be for the Partnership for Maternal and Child Health.org. And that is the easiest way to reach out to us right there on the web.
Awesome. Well, thank you so much for being on the show again. We always appreciate having you.
Always a pleasure. It was a pleasure speaking with you.
Awesome. Thank you, of course, for listening to Educate US, a proud member of Leon Media Network. Make sure to download us on iTunes, Spotify, or wherever you get your podcasts. If you're listening via Apple Podcasts, be sure to leave us 5 stars because that really helps us out. And make sure to join in the conversation by emailing the show at theeducateusshow@gmail.com. Thanks, everybody.